book, one of the many things was that you also talk about self-management. Like, yes, you've got all this complex biomedical stuff going on, at multiple levels. And it's also true that what we do ourselves on a day-to-day basis, the decisions we make
Yeah.
about sleep and exercise and diet and managing stress, those kind of things can have a really significant role to play in healing. I was just wondering if you could say more about that, because in this community, as you know, a lot of people are really hanging out for the fancy biomedical treatments and
Yeah.
maybe, at the risk of offending someone, maybe don't pay quite as much attention as they could to some of these things that we actually can do ourselves.
Yeah, I mean, I'm glad you brought that up. I really struggled with that second part of the book, to be honest with you,
Okay.
because I see so many chronically ill patients that I knew that I probably, I wasn't sure how they would like be, how receptive they would be to this
Hmm.
idea that a lot of what we do in general for ourselves can play a role, right? Because I know
Yeah.
that my patients, obviously they can't exercise. They end up with post-exertional malaise or just more fatigue and sometimes flare of symptoms. And the autonomic nervous system, when we exercise, it very much relies on our autonomic nervous system. So it can sometimes flare symptoms very easily to even mild movement, even going for
Hmm.
walks. So I fully aware of that, fully aware of that. So I have really had to struggle with like how to word things and,
Yeah.
with understanding that this would not apply to all of the patients with chronic and complex illness. But I still think it's important in the sense of like the resiliency of our bodies, like and I don't
Hmm.
know if I was successful in making that point in the book, and at least in the second half of the book. I think the resiliency of our bodies is what keeps us alive and what keeps us fighting back the exposures, or at least the consequence of those exposures. And the more that we can improve the resiliency of our body, the better off we'll be to any extent. And I'm not saying that it would be a cure, because it certainly won't be.
Right.
But it could help. It could help any intervention that's done. It could help your body tolerate that intervention. It could optimize the response to that intervention. So it's really about the resiliency of the body. I mean, I have such great respect for human physiology and what it can and cannot do. And so and that's what I was thinking when I was writing that part of the book. Like the more that we can, improve the resiliency and respect that physiology, the better off our homeostatic mechanisms can play a role, which we need, right? We need them
Hmm.
to come back online. And so we have to support them so that when they are able to come back online, it's with more efficacy.